I don't think you can have a podcast for vets on how to thrive in their careers without talking about psychology. The mental and emotional challenges that get hurled at us on a daily basis definitely requires a significant amount of ongoing preventative care and maintenance. It's like that iPhone ad from a few years ago with the phone in a wind tunnel with all the crap being blown onto it. It might be a sturdy phone, but if you don't stop every now and again to give it a good clean, sooner or later you won't even be able to see the screen and the buttons will get all sticky. If you're a regular vet velter, you'll be well familiar by now with psychologist Rhonda Andrews from our previous episodes with her on trauma and grief. If you don't know her yet, Rhonda is the founder, managing director, and a senior psychologist at the Barrington Center, a specialist psychological firm that works with individuals and teams to help them address complex environments. Rhonda also helped create a program specifically modified for the vet profession called Systems of Support, or SOS. We love Rhonda, and based on your feedback, you loved Rhonda. So, we're going to make this a regular thing. See it as switching off that wind tunnel every now and again and wiping off the gunk. Here's how we're going to do it. Rhonda will have conversations or counseling sessions with real vets facing real challenges about the stuff that they struggle with, the stuff that comes flying onto that screen. They'll explore solutions and strategies to help them get unstuck from current problems and to prepare them for the things yet to come. We will then wrap up the conversation with some additional questions and comments, and you get to listen in and apply these strategies to your own career. We'll do a really thorough examination of each topic, which explains our possibly tasteless but highly illustrative name for this series, because you know that you haven't done a proper exam until you've done the rectal. In this episode, Rhonda is joined by Dr. Kurt Enzinger, an equine vet and practice owner with 2 decades in the vet game, a busy practice, and a big team, who, like the rest of us, is currently facing a very heavy workload. Rhonda and Kurt explore that very disruptive and counterproductive thing that our minds tend to do to us at the most inconvenient of times: rumination. As vets, we know exactly what that means. Literally, repeatedly vomiting up the same old thing so we can chew on it a bit longer. Isn't that just the best word to describe the mental version of this process? We cover what it is, how to prevent it, spot it, and stop it. Please enjoy Rhonda, Kurt, and Rumination. Welcome back, Rhonda, to the podcast.
Thank you very much indeed. It's delightful to be back.
We want to tie a bow on your discussion with Kurt on rumination.
Yep, done. It was a great conversation with Kurt on the rumination, and as true to someone who is, even though he says he's not a ruminator, he really ruminated, and we went down all these little rabbit holes.
Yeah, there was a lot of value there. There's not a lot more to be said. I think you guys covered it really well. I wanted to highlight or double click on a few of the things you mentioned, and of course I have questions. I always have questions. Just be clear, maybe as an introduction, just to define it a bit more clearly, because again, we live in our heads, don't we? We live in the past and we live in the future, and inevitably we're replaying and reviewing stuff that has happened. That's annoying, but it's normal to do it to some degree. When is it that we cross that line between normal evaluation, the post-match analysis of what's happened in your day or your year or whatever, and then when does it flick into rumination?
Yeah, and it's a really good point, because as you said just then, it's normal and quite healthy to reflect on things, but when does it shift from being healthy to unhealthy? And I think for me, one of the things before people listen to what Kurt has to say is we've got to really define what is rumination, and just as importantly, what does it actually feel like for people? And for me, rumination is focusing on something that's happened and looking at what caused it and how it made you feel. And it's being stuck in the thought pattern that you go over and over and over it, but you're actually not focusing on any solutions or actions or how to move forward. So what happens is you really feel stuck in the thought cycle that you can't get off. And you're very much stuck in the past because you're stuck in the memory of what's occurred rather than what's changed or what you can change. And so it's got a depowering part in it. And if I parallel veterinarians and the veterinary sector, so that's nurses, that's the administration staff and everyone, if I parallel that system with the medical system, they actually have a very similar high rate of rumination. And just in our anecdotal evidence, people actually say to us that on average, we're getting up to about 80% of people within both these professions saying rumination is something that they really do regularly. That's high. That's very high for one profession.
Wow.
And two professions that are very similar. I always say to people, well, let's actually unpack it. What does it feel like? And the commentary that I hear and Barrington hears from different veterinary staff is that they talk about getting stuck in a thought pattern. They really feel that it comes on at night time, so it really plagues them during the night. They wake up, sort of, it was like someone's thrown on a switch and all of a sudden their brain's kicked in. It can go on for hours or it can go on every night of the week. And it really interferes with the sleep pattern. And it has a real flow-on effect, because what happens then is when people then don't get enough sleep, they get, as we know, fatigued. And then the consequences of that are physical symptoms of reduced concentration, getting ratty, feeling agitated. People sometimes then procrastinate. And so it really has that secondary and tertiary consequences. So when you ask the question of when does it flick over, it flicks over when you are repeatedly just going over the same thing. That, I say to people on sort of like a rough rule of thumb, 3 times is really enough. If you, after 3 times of rehashing the same thing and you're actually not coming up with anything you're going to do differently or anything you're going to now do because of it, then you're in the risk category of it becoming unhealthy.
I really like this because we're getting practical now, because a lot of the wellness or the mental health things we talk about, it's almost like clinical vet work. You can understand or you can know the knowledge, but when the shit hits the fan, to actually apply it is a different story sometimes. You can read all the books and understand it, and then it happens to you. And I think what you discussed there of recognizing it, the self-awareness of going, hang on. Otherwise, you just drown in these circular feelings of almost self-flagellation, and you don't know why you're unhappy, you don't know grumpy, but you have to recognize it. And I like that we're talking about what does it feel like, because if you can't identify this feeling that I'm having, that's this. You can't name it, you can't do anything about it, or you're less likely to act upon it. Let's switch over to your conversation with Kurt and see if he had any more insights for us on what does it feel like or what does it look like.
If I could just step back for a moment and just speak about, well, let's look at all the raft of things that stress us. And there's a myriad, and I'm sure Kurt can give us heaps of those. And what I'm really looking at here is, we've got, if you like, our emotional well-being, we've got our mental well-being, and we've also got our physical well-being. And so all 3 parts play an integral part of success, of being able to be resilient, being able to adapt and be agile, and be able to deal with the different things that come onto our plate that don't bury us or snow us under. And so at times I'll be asking Kurt, certainly from an individual perspective, what that means for him, how that has a knock-on effect to his team, and if from an organisational perspective, or if you like the professional perspective, what else is the overlay on that? Because for me, solutions are at an individual, team and a system level, and I'd like to bring all 3 into play. So let's get into it. I warmly welcome Kurt Enzinger, and he's going to kindly help me unpack it. So if I asked you, Kurt, What does rumination mean for you, and what does it look like either for you or for others around you? I'd just welcome your thoughts.
Yeah, Rhonda, I think that rumination to me, it's something that I do probably in retrospect now think about all the time. And it's probably something that I try and avoid all the time, and try and get the rest of my team to avoid it. Conducting yourself, making decisions on cases or, other things during the day so that you don't have any regrets, or it's not going to keep, and my staff would attest to this, I'd always say, do what you've got to do so you're not going to lay awake tonight thinking about it. And so I try and disperse that during the day so that you don't ruminate when you go home, because I think that's when you do ruminate, is when you're by yourself, when the stimulation's gone, and maybe when you're laying there at night in bed looking to try and go to sleep. And for me, that's the definition of rumination, is that when it's something that's there churning in your mind and keeping your mind active and consuming your thoughts. So that's something that's on my radar that I try and avoid for the team and myself.
Yeah. And as you say, it really is plaguing, isn't it? Like, it just hammers you.
Yes, yeah, it's consumes your thoughts. I think consumes your baseline thoughts all the time.
Yeah.
It's interesting the things that you say that you guys come across. To me, it's almost a repetitive thought process, but it's associated with physical manifestations of negative emotions.
Yeah, exactly.
So increased heart rate, or tense neck, or every time that thought enters your head again, there's a definite it's an unhappiness that lives with it.
It's that right side of the neck that all of a sudden goes twang.
Yeah, or a stomach. Your stomach goes, and every time you try not to think of it, but every time you do, your stomach's in a knot or something like that.
And then people have really associated triggers, like a smell or a colour or a visual of something. And I know people who, let's say that they've not had a good experience with some particular surgery, and they've looked into it and they've discussed it with colleagues, and they say, look, I didn't do it as well as I wanted. I'd like to do it next time. So all of a sudden, all the events or the environment of that particular, what they classify as their perfectionist, a disaster, they can be somewhere which is well outside the surgery, and all of a sudden they have that colour or that smell, bang, they're straight into going right back into that surgery again. And as we all know, once it starts consuming your thoughts, then, it's really starting to impact then upon you emotionally, and just your level of physical energy and just how you may be tired. So I guess I'd be interested in, how does it show itself? How, for instance, I was talking to a student vet, and they were looking at some of the surgery they'd done, and they were ruminating exactly as you just said then, Kurt, at night time, and they were looking at all the research, looking at all their books to actually say, how could I have done a better job on that surgery? And so they were really what I'd call self-flagellating, beating themselves up about, I did that wrong, I could have done that better. And so they might spend hours of a night time reflecting and reassessing their performance in surgery. So I'd like to know, from your perspective, how do you know it's there? How do you know it's there in your staff?
I think what you've said there's a lot of points that I could comment on from those, that your last comments there. For me, body language, or just, I hire a team of high achievers, like-minded people. We need to be culturally aligned, same core values, all aligned, to be able to work in this team. And so I think high achievers suffer this more because they do strive for the best. They do, and I'll often say to the guys, you want to be better tomorrow than what you were today. And that's how I sort of look at life in general and try and drive the team. But I think lack of enthusiasm, I'm quite a jovial sort of a person, and keep things light when I can. Well, not when I can all the time, mate. Basically, you can make a joke out of every situation, and you sort of see, I suppose I look at their reactions to that sort of my characteristics, and if they don't react the way they normally would, or if they're a bit more quiet or lackluster, I suppose, in their day-to-day, maybe it's showing up to work a few minutes late, maybe it's not staying back to finish that report or whatever. that's how I'd probably notice it. I don't tend to notice it as much in their work. I think they're very, very diligent, and if they're coming up to a case that they aren't sure of, they will be in those textbooks or online looking at studies before they jump in. But I think, how do we know ourselves? We may ruminate, and I think it's if it's in your subconscious, if you are worried, and that's what I say, whether it's surgery, whether it's a call on a medical case, or whether it's even just maybe the way you spoke to a client or handled a conversation with a client or responded to an email, even as simple as that. I think you know in your heart that maybe you haven't done the best that you could do in that situation. So I think it's good to ruminate a little bit to see how you can avoid it next time, but not dwell on it.
Yeah, and that's a really good point. And you tie that in really nicely, Kurt, with the whole thing about perfectionism. You know, you've got an A team, they're going to be people that are high achievers. So by default, they're going to be self-critical, and that's an asset, providing it doesn't then become a plague where it just perpetuates and they can't let it go. So it's about, as you say, great to do an evaluation or review, but not when it becomes so repetitive that it becomes destructive.
Yep.
Yeah. So let's do a deep dive into you. What are you ruminating on, and when does that happen, and how does it look? And does anyone in the family know that it's happening?
I think I can't see how they can't know. I during these times a little bit unique. We have had to push, and we've been really busy, as the veterinary industry has been through all of COVID. I think a lot of the vets, we do know how to work hard. We can dig in and do the job. But I think for me personally, not being able to have, I don't take a lot of time off, but two weeks a year I do go with the family to North Queensland, and where I can't help, I can't chop wood, I can't mow lawns, I can't do any of those things that I have to do at home in the same postcode as work. But those 2 weeks I didn't realise, because I've missed out on that 2 years in a row now, that is actually my total unwind, and where I can be Disneyland dad to my family, and they get my undivided attention because I haven't got work to deal with. Work are really respectful. They don't ring me unless it's an absolute dire emergency, and I probably ring them when we're away because twice a week, just to check in to see that they're okay. And that for me has been the biggest thing through COVID. So that for me is high on my agenda, my list at the moment for what I ruminate about. But there's no point really ruminating about it because it's out of my control. So I think we only ruminate about things that are within our control that we can change. And so for me, staff, the team, running the team is probably, it's one of my vital functions of what I do. And, I have, because of the fatigue and with COVID and things and keeping on pushing through, I don't get enough sleep. I'll admit, probably drink too much alcohol, more than what I normally would, to try and get that relaxation perhaps at night. And I'm lucky I'm a really good sleeper. So I try and clear my head before I go to bed. So I really don't ruminate. I probably work 13 to the dozen during the day, so that's probably when I'm doing my rumination, is driving between jobs and seeing which is the biggest fire I've got to put out next. But yeah, running the team, staff, making sure they're okay. And it's hard when you are fatigued to you don't, scheduling reviews, as you just said, reviews are great, just such an asset, and it's been brought to my attention recently that we haven't done reviews for a very long time, and they are a good chance to vent or address little issues before they become larger ones. And so we haven't been able to do that. I haven't had a practice manager through the COVID period. So that's been difficult, having to take on the HR issues or not taking on the HR issues, as the case may be, and looking after the staff in that way, because it's probably, as the boss, it's maybe not as pertinent as it is to the staff. And I'm male and all of my staff are female. Not that makes a difference to me, but that can make a difference with HR if they've got to come and talk to me or something, if they might not feel comfortable about certain issues. Probably during the day for me is the rumination time, not at night. And I'm probably a little bit unique in my position as the boss rather than the employee.
But I think there's a couple of really key points I'd like to pick up on that. Kurt, you made the comment about rumination. Are we ruminating about things that are inside our control or outside our control? And I think, often when I speak to people and they're talking about rumination, often when they can have a look at things that they can evaluate and have the chance to go back and improve upon, then they've got a way of measuring the value of reflecting or the value of letting that go through their brains. And I think that's really effective. I think that is a really valuable part of our performance or our satisfaction, because we see, okay, I've had a look at that. I know a way I can do it better, and I'll try it. And odds on, it usually works. And so there's that gets reinforced as a strategy. The stuff that I see which really spirals and brings people down is when they're ruminating about things that are outside their control. So they're going over and over and over stuff. And so, if you like, they're going back and back and back over it, which then just brings them down and exhausts them. I guess for me, they're the ruminations or the critique that people have of themselves, which don't actually add value to the improvement. If they turn it around and say, what would I do differently next time? Totally different story. But if the rumination is just going over what's happened, it's a dead duck, and it doesn't help. When you would hear people doing that, how do you handle it?
It's hard because all the different staff members do it differently, and they all have their strengths and weaknesses, and some care more about comments from other people, and some deal with it, water off a duck's back type of situation. And for me, it's hard when I get presented with a staff member that's already cooked themselves about the issue, and they show up to work. It's got nothing to do with work, and it's something out of their control, but it does affect them emotionally, and it does affect them, and then therefore it affects their work. And you can't be I can't be the big bad boss saying, well, you still got to do your day's work and expect them to, but I try and just give them some sort of allowances. I mean, there's often nothing you can say that's going to change the way they feel. I try and help in other ways, and you can always offer other things, or I don't know, some time off or whatever.
And I think it is a really challenging one, as you said, because often those ones are outside people's control, and you can't fix it. They can't fix it, but yet it is impacting upon them. And nicely, as you put it, Kurt, you see the interconnection and the consequences. And it's a bit like a vicious cycle. And then the person may feel in some way a reaction to how they're working, and then it becomes a cycle. And I think your point's a really good one. It's trying to break the nexus of that. It's trying to break that, have a circuit breaker in there. And the circuit breaker can be time off. The circuit breaker can be, some acknowledgement can often be a great thing. Doesn't have to be in monetary terms. It's a verbal acknowledgement, something that most people really appreciate, that they then think that person, whether that be my boss, whether that be my co-worker, whether that be a family member, they get me. They understand what I'm sad about or what is stressing me at the moment. And that listening part, Kurt, I'd like to give you credit. You're a good listener. And so therefore you listen to what's happening to people. And that, by being able to acknowledge that to people, is half the battle. Because when people don't feel heard, that's when they get pissed off.
And I feel that communication, most breakdowns or misunderstandings, it's all through lack of effective communication. And I think that just direct communication rather than through somebody else or through another means, for me, direct communication is the best way. Because if you don't know, we're not mind readers, and we've got, as I said to you before, I've felt the most stretched in my career ever in the last, definitely 12 months. And so my receptors are probably going to be down or taken up already, and I'm not going to notice as much as I maybe should. And so one of my techniques is I try and relate back to team. So if the staff member's down or two or whatever, and often one staff member down can bring another one down and another one and another one. And so I try and do some sort of team-based thing. Now, whether it's just take them out for dinner for no good reason, whether it's we had a bad debt paid and say, let's go and, go for a breakfast or whatever, or here's a movie voucher, it's something like that. But it's been really hard. We haven't been able to do that. And so it is lacking. And so the team vibe, the team energy does suffer, and then you put fatigue for us as well, and then that puts more fatigue, gives you more fatigue because you're trying harder to keep it going. So
exactly, you've got all those overlays, but if I just unpacked what you said, what's really important is just how one individual can influence the mood and the feeling that others have from a cultural perspective and just a vibe at work. And so there's that knock-on effect of how one person's feeling can influence however big the team is, whether it's only another 3 people or another 20 people. And so that influence is really strong. And I think that's a really important part that can either bring a team down or it can lift them up. And I think your other point is a really good one as well, of that celebration as a team. And it doesn't have to be for any particular reason. It's just getting together and that acknowledgement as a team. And yes, during COVID, we haven't been able to do it in the same way, and people have had virtual parties and virtual dinners, and I think people are sick of virtuals of everything. But it is about that recognition of how the individual influences the team and vice versa, and how critical that part is. And I've heard some really good things during COVID where vet practices have really brought in quite a lot around the debriefing. So debriefing from, just a quick catch up at the end of the day, or a quick catch up in the morning, or once a week, of where they're just saying, okay, and pardon the French, but they go, what's been the shit and what's been the gems? And so that's what they've called it, the S and Gs. And so, like the G and Ts. And so they've made it that let's put out there what hasn't worked well this week, and let's put out there what's really something we could celebrate. And so people have been able to put on the table not so much the practical things like from a clinical perspective, but more they can then speak about how they've reacted to it. So from an emotional perspective, I just welcome your thoughts on that as a strategy.
Yeah, I refer to it as a purge. I think the huddles in the morning, we sort of indirectly do that when I look at the scheduling. So a huddle in the morning, I think, is good to work out potential problems during the day. I mean, we don't do it daily, but we definitely do it on a case basis. And I really do try and take time. And it's funny, one night during the week, I'm, stay back with, because I'm the first to arrive usually and the last to leave, like most bosses. But there's always one vet that's on call, and so that night I do get to have a one-on-one with them and try and extract a bit of anything that they want to talk about out of them. We do have weekly meetings every Friday morning for the team. We have an agenda that you can put anything on. So if it is something that's annoying you, or one of your S's, and also I try and always bring one of the G's. But I think 100% that purge or that debrief is really important. And I think that getting it off your chest, and that's what I try and do with them every day, especially with cases. I would like to think that my guys don't go home and ruminate about cases. I really try hard to nail that and give them comfort in decisions, or give them strategies in how we're going to deal with it if they're not happy with how something went, or how to change it or make it better, or
And that's a strategy in itself, that whole thing of let's talk about it during the day rather than the individual vet going home. It might be a vet nurse going home and just doing their own thinking about it, that there's a discussion about it. So before they get in the car and head home, they've already got, if you like, a perspective on it that's just not their own perspective. There's been some contextualising that's happened either from yourself or from another colleague. And I think that's a really critical strategy, because sometimes our brain's our greatest asset and can be our greatest enemy. And so when we get on a roll with rumination, sometimes it can take us down some pretty dark tunnels. And so if we've actually got a different perspective before we go home, then we've already started to shape some of that context, and we've got another voice coming in rather than just trying to qualify it on our own.
Yeah, stop the snowball.
Yeah, exactly. You made a comment, at night time you clear your head before you go to sleep. How do you do that?
I try and reason with myself. As I said at the start, I try and be very, it's always the way. You can be very good at giving someone else advice, but when it comes to yourself, you're not always that diligent. But I really try and have a stern talking to myself if I am worried about something, and say, and I do ask simple questions. Is it something I can control? What can I do to make it better? If you can do that and be honest with yourself, because most of the time there is you can, even if you just make a decision that, okay, I'm going to get up and I'm going to do this tomorrow, I'm going to contact this client. If you make a strategy so that when you wake up, I think if you're content that you know what you're going to do when you wake up, I think it's easier to go to bed.
But I think the key thing that you've said in there that's really important is that you plan. And so what you're doing is that whether it's before you go to sleep or it's thinking about the following morning, it's what's the plan? So what people are left with in hitting the pillow is, it's not like this is all jumbled and what am I going to do? You've got a direction, you've got some goals, you've got some actions. And I think for people, when they ruminate, it gets boggy because people feel like they're just going round in circles. And so part of a plan or part of an action plan gets people out of the weeds or gets them out of the thickness of the forest and actually gives them some direction. So in finishing up, Kurt, I'd like to ask you, people who are listening to this and who a rumination has worn them down and has been something that has been part of a pattern for some people for many, many years, what would your first step be for them as a strategy to get out of that endless loop?
I've got a saying that I say with the staff is eat your frog first. And so when you go to a restaurant and there's frog on the menu, no one's going to order that. Well, I'm not anyway. But I think that if you have a series of problems or rumination topics running around in your brain, get rid of the one that you don't want to deal with, and get rid of that one first. And I've had this, I can absolutely attest to this. If I've got something to do that I really don't want to do, and I don't do it first thing in the morning, and I sit on it all day, I do ruminate about that all day long. And it's just another thing affecting me, whether it's mentally, physically, emotionally, whatever. But it definitely does. If you just get rid of that straight away, you have a much more productive day, you have a much clearer head, and you have a much more positive psyche about the day. So about eating your frog first. And that's something I really believe in. And my staff even say it to me. They say they can see I'm procrastinating on doing something, and I go, "Eat your frog, boss man, eat your frog," and it's just they just leave me alone, and I do it, and then off we go.
They've got a cue for you, haven't they, Kurt?
Yeah. Well, they've heard it from me enough. I just tell them to eat the frog, So, and like you said, just pick one. The direction you need to go to get out of it, and it doesn't matter if it's the right decision, but as long as you make a decision to move away from where you are, that snowball or that churn or that whatever you want to call it that you're in, that cycle, that vortex, I think you've just got to jump out of it. And it doesn't matter how far out of it you are, just as long as you're out of it a little bit, and then you can reassess and move on and make more decisions.
See, to me, I feel like there's two overarching categories of topics of rumination. Number one, and probably the most common, is I'm an idiot. I'm an idiot. I stuffed that up. I shouldn't have said that. I should have seen this. I shouldn't have missed that on the diagnosis. I'm an idiot. And the second category that I could sometimes ruminate even more is you're an idiot. Mm-hmm. I had an argument with that person, that client who said that. And you have these stupid arguments in your head about a discussion that happened 5 days ago, but yet you're still arguing. You're still saying, yeah, but you, which does almost get me more. I can't, maybe it's my personality type that I don't like conflict. And when there is conflict, I keep reliving it and keep redoing it again.
And I think those two levels, Hubert, are really good to differentiate, because the first one is about how we see ourselves and our own self-perception, and that's where the self-flagellation and the rumination comes in. You're an idiot, why'd you do that? That's a stupid mistake, da-da-da-da-da. And that's really the perfectionism and the, if you like, bordering on the neuroticism in us. And the second is very much, whether you like conflict or not, it's where there's been an interaction that's unfinished, or it's finished in a way that is not satisfactory to you. So the brain wants to go back there and tidy it up, because as human beings, we like things neat. We like things resolved. And when it's left with lots of mess or left with little pieces hanging, the brain goes, I'm going to go back and I'm going to replay it until I can tidy it up. And, you become the angry customer, you become the vet or the staff in customer service, and you just rehash the entire thing. And at some level, we need to put it to bed, and we'll never be able to unless some people say, well, I need to go and contact that customer, or others need to just say, it was a bad experience. If I ever get someone like this again, this is how I'm going to do it. This is how I'm going to deal with it.
I wonder if that's why we're more prone to ruminating about those sort of interactions, because these are people who are transient in our lives in many cases. It's a once-off interaction, and short of borderline stalking them and confronting them about this thing that's in their head, probably long gone. They've probably long forgotten about it, and yet we are obsessing about it. The other scenario, and this is ridiculous, but I'm sure I'm not the only one, but that brings this on for me, is social media stuff. When I see stuff on social media that makes me angry, and I'm disagreeing with a complete stranger who doesn't even know that I'm reading his thing or his comment or something, and 3 days later I'm still arguing with this imaginary person about some stupid fucking thing. I experienced it personally a lot during COVID. A lot of the COVID discussions, which we've mentioned before, was obviously a trigger for me because of my personal and family experience with it. And I'd read stuff on social media that would trigger me so much, to the point. I mean, there's a guy I vaguely know that I actually messaged him and said, "Can I talk to you? Because I had to talk about it, because I was arguing with him in my head for weeks on it."
Yeah, and as you say, particularly in COVID and that social media, it bordered on a real intrusion and an invasion in people's lives, because it was flooded. And so, if you like, there was what we call, from a psychological perspective, a real transference then of people's views into our lounge room or into our brain or into our lives. And when you didn't agree with it, it was like, I can't get these bastards out of my head.
Exactly. Or it can be a throwaway comment. I know one of our listeners once, a friend of mine, made a comment that somebody at a conference said something, alluded to something, but they took it as a slight. And she said, can we talk about rumination on the podcast? Because how does she deal with it? Because she was just replaying this comment. Was he insulting me? Was it aimed at me? Was it? And those scenarios where you can't go back to get closure on the conversation. Again, what are the steps? How do you break that cycle? Or I think you said in the discussion with Kurt, the circuit breaker. What's the circuit breaker for that process?
Yeah, and I think let's just firstly, can I just unpack it a little and just go back to when we look at the veterinary sector, I think we need to say, okay, well, who's at risk here? And I think we need to be quite real here and say those who are attracted to the veterinary sector are perfectionists themselves. And so therefore they're going to be, and it's healthy still, but it's going to be something that they will do automatically, is ruminate. So let's put it on the table and say that's a given. So we're not here to change and say, don't ruminate. Yeah. What we are here to say is you will ruminate, but let's cap it. Otherwise, it takes over you rather than it being a healthy process. Okay. And I think the other things we need to say is that people are going to be triggered, particularly if they're stressed or exhausted. It makes us more vulnerable to rumination because we are more critical of what we have just done, and therefore that leads us into a much deeper evaluation or re-evaluation of what we've said or what we have actually just performed surgery or with a customer.
So why is that, Rhonda, that it's worse when you are tired or stressed?
Yeah, because what's happened there is from a hormone perspective, and just from, if you like, our clarity around our decisiveness and our using our rationality gets into a bit of a fog, a bit like what people talk about when they are talking about COVID. That is something that people experience when they're, excessively tired and exhausted or really stressed about something. They feel like they're operating in concrete or in a fog. And so therefore that leaves us much more prone to rumination because the brain finds it easier to rehash rather than say, I'm going to make a clear decision here and this is what I'm going to do about it to bring it to a close or to improve it for down the track. And so, I don't know if you've ever noticed yourself, Hugh, but when you're tired, take on more stuff. Take on, you don't say no often enough. You go, yep, all right, yep, all right, yep, all right. And it's the worst thing you can be doing. But it's easier just to say yes than it is to say no when you're exhausted. And that's what happens with rumination, that we are very much more vulnerable when we're fatigued or exhausted. And then rumination just becomes, if you like, a pattern of a cycle that just keeps reoccurring during that tiredness.
Okay. Thanks.
So I think it's really important to say, okay, well, what can we do? Because I think that's the real thing, and you'll hear that from what Kurt says, in that it is about really looking at, okay, what's in my control and what's outside my control, because often the rumination is focused on things that we can't control. Like the example you gave, the guy who was in the social media, in the end you had to contact him. It's the customer that's gone off and you're still ruminating it 5 days later, and he or she's probably totally forgotten about it after 2 seconds.
Yeah.
And so it's really looking at what is it there of what we can control and can't. And I think the other, and it ties back to what I was just saying, it's our own self-belief, our self-perception, the expectations we have on ourselves, because there is a correlation, and it's well documented research-wise, the correlation between if you've got really good self-confidence and you believe in yourself, then rumination will be well controlled. Okay. Because if you don't have a good self-expectation and self-esteem, you will doubt yourself all the time. And rumination feeds on that.
Is that because your subconscious or your brain is still trying to figure out how to do things, and so that the process of evaluating invariably is going to be more to evaluate what did I do, and then it's much easier to slip from evaluation into rumination?
Yeah, exactly. That's right. And it's really, I really encourage people to just check in on their self-talk, because when it really dives into that really harsh, what I call harsh judgment of yourself, it really then becomes a feed to the rumination. So it just really accentuates it. And so that's what we want to, if you like, turn off and make sure that doesn't become a self-fulfilling prophecy. And I know of a lot of perfectionists who say to me, and it's fascinating, when they say, I want to jump in first and be critical of myself before any other bastard's critical of me. So they do it. They say, and it's quite interesting, they say, I'm going to be the harshest critic because no matter what anyone else says, it's never going to be bad or it's never going to be worse. And so it's a really interesting paradigm that they put themselves in. It's like, get in first, get in with the boots and all, really do the worst possible number on yourself, because no matter what anyone else says, it's never going to be as bad.
So what do you advise to somebody like that? How do you address it or prevent that from, how do you treat perfectionism?
A lobotomy.
Prof. Gordon said, his comment was, we don't treat perfectionists, we employ them.
A very good point. Perfectionists are wonderful. But on a serious note, I think it is about saying, and it's acknowledging that's what perfectionists do. And it's not trying to turn that off, but what it is just saying, it's a bit like what you said a moment ago. It's about acknowledging, I do that because it's my safety net. Mm-hmm. It's the way in which I make sure I've gone over the option that's going to have the worst possible scenario and nothing's going to be as bad. And so as long as you acknowledge that that's why you're doing it, and then you're only doing it, say, once or twice, then that's fine. But when it repeats itself, that's when it has a very negative consequence on our mental, emotional and physical well-being.
Can I make a comment about a strategy of mine that I've learned recently? Because you can't fix your head with your head, can you? You can't, because even when you recognize it, you go, I'm ruminating about this stupid thing. But I've got to fix myself. And a way for me to externalize it a little bit is to actually write these things down, but write them in a question format. So, so you talk about, so what can I control? But just thinking about what can I control still doesn't quite do it for me. So I literally have to write down, what can I control the situation? Answer it yes or no. What can you do about it if you can't control it? What are my actions going to be? What's my plan, basically? If I can't control about it, then I can evaluate and say, okay, and my questions will normally be something along the lines of, what were your intentions? So it helps for me to have a perspective on when I did this thing that I'm now so grateful about. But what were my intentions when I did it? Was I trying to be malicious? Was I trying to screw somebody over? Was I trying to kill my patient? No, I wasn't. I was acting within my abilities on the day with what I had. Maybe wasn't on top of my game. Yes, I should have done that. On a better day, I would have picked it up, but I didn't intend to cause any harm. And then my last question is always, okay, what can you learn from this?
Yeah.
And that helps me a hell of a lot. Again, I like that word that you used, the circuit breaker, to say, well, let's get this out of my head and get it onto a piece of paper. And often that is enough to say, okay, now we've addressed it. Now let's move on. Let's let this go.
Yeah, and I think that's a really good way. And you can even take what you've done, Hubert, and break it down even further. Because if you say, well, can I control this? Well, it's important to say, what is the it here? You know, like if it's a bad argument with a customer, well, what is the it that I can control? I can't control what the customer says. I can control what I've said to the customer and also how I've reacted to that customer. And so it's important when you write it down that people break down the event or the situation, and so they can actually see the small components of it as well. Otherwise, if it stays as a big metamorphosis of just, you know, a shitty situation, it's then hard for people to say, okay, well, what parts of that can I influence?
That's excellent.
I guess the other thing is, just in line with some practical things, another one that I've heard that the veterinary sector use a lot of is what's called the catastrophizing, because they're pretty good at catastrophizing. So yes. they go pretty quickly to the worst thing that can happen. Yeah. But what we often train the veterinary sector to do is they can quickly go to, okay, what could happen in this situation? Yep. And therefore, what is it that I see as the worst possible event? And then what we say to them is, okay, just for a moment, just stop and say, right now, if there was a phone call coming in, what would be the worst thing that you would hate to hear in your life coming through a phone call? And for most people, they talk about some family member or a loved one overseas or whatever, that they've had an accident or they may have been killed. And all of a sudden we say, so now put that, listening to that conversation, that telephone call, just against what you've said about the worst thing of that particular event. And all of a sudden, the catastrophizing realigns itself in life. It brings it back into a comparison of what's life all about. It brings that reality back in that split second when people are feeling like they want to vomit, they're overwhelmed by the event that has caused them to go well beyond ruminating and they're catastrophizing.
That's really nice. That's a really practical tip. I like that a lot. Rhonda, I have a few more comments. The one thing again, from seeing it in others and doing it myself is, and I don't, it's a comment, it's a question, I don't know, maybe you can comment on it. All right, I can control this by doing this and this and this. So let's take it to the clinical scenario. All right, I made a mistake, a clinical mistake. What can I do about it? All right, I can learn, I can get better and not do it. But then that could become a very obsessive thing to go, I always can do more. You know, if I worked harder, then I could have prevented this. So I'm going to work harder. If I studied more, and it can ruin your life. That's a one-way ticket to burnout, to go, there's all these things that I theoretically can control. And especially in our career, there's always more that you should know. There's always more skills that you should learn. And it can become a real burden to live like that, to go, well, I need to fix all these things. I have control over them.
There's no limit.
So I don't know, what can you say to that? Is it just...
Yeah, and it's a good point, because when you start saying that, we can all improve and there's really no limit to that improvement. Mm-hmm. But I think what I say to people and what I encourage and invite people to do is, when you are learning, just be very specific. What's the one thing, very small, but what's the one thing that I want to do differently? And it has to be small that you can do the next time round. Okay. And that's your achievement. So rather than saying, you know, I'm going to be the best of, or, you know, I've done this, now I've got to do this, now I've got to do this, now I've got to do this, and I'm forever, you know, that's another rumination, because you're self-flagellating and saying, hey, yeah, okay, so you've done better, but now you can do even more.
Yeah.
So what I say to people is, I invite you to say, what's a small thing you want to change the next time you have an altercation with or you have an angry customer, or that something's gone amiss with a euthanasia, or something's happened with a particular surgery, or a conversation with the customer service team backfired. So what's the one thing that you want to do differently, and measure it. It has to be measurable. I want to see that when I go to Jane in customer service and I say to her, so how are you this morning, Jane? That I actually listen to her. I make eye contact and I listen to what she's saying, rather than just racing off down the hallway ready to start surgery. So it has to be that measurable around what's the change you're going to make, and that's your achievement.
I really like that. It's a question of actionable steps. It's somewhere between I'll never be good enough, so I may as well not try, versus I need to be perfect.
Yeah.
And you can go the middle way and say I need to be just a little bit better.
Yeah, exactly. And I also encourage people to listen to the feedback they get from others, because often as perfectionists, we are very dismissive of positive feedback. And we go, oh, they're just being nice. Oh, yeah, she or he's going to say that. And we're very dismissive. But I really encourage you to listen to it, because it happens daily. People do give a lot of feedback in just their commentary and narrative as they're racing between patients and racing between appointments. And it is important to pick that up and to receive it well rather than batting it away or dismissive of it. And as I say, perfectionists are really prone to wiping away positive compliments.
Marvelous. Well, are we done? Are we done ruminating about rumination?
I think we are.
That was magnificent, and I think it'd be a really useful topic. It's obviously we all struggle with it, and thank you so much for your time on it again. Our goal here at the Rectal is to have conversations like the one you've just listened to that will give you inspiration and fresh ideas on how to create a thriving and happy career and life as a vet. You'll know by now that our focus is on the life skills that we need to navigate this challenging and rewarding profession of ours. But there's something that I've realized over the last few years of exploring ways to increase enjoyment of the job. That is that the vets who are confident in their skills and knowledge are, as a whole, more satisfied with their careers. Which makes sense. When you feel rusty or uncertain in your knowledge, it's very easy for those imposter feelings to sneak in. I don't know enough. Am I good enough? Conversely, we know that feelings of growth and mastery are some of the greatest predictors of a happy career, which is why we created the Vetworld Clinical Podcasts. 3 highly practical episodes every week. Conversations, not lectures, with world-class specialists. Tips, updates, real insights, not textbook theory. Short enough to listen to on your drive to work, but with enough content to ensure that you'll be a little bit better at your job than you were before you listened. Join us on our journey to better by trying out our free 2-week trial at vvn.supercast.tech.